All right, so today I'm talking about ankylosing spondylitis. This is a condition, um, it's a type of arthritis that primarily affects the spine, but it can also be called rheumatoid spondylitis. It causes inflammation in the vertebrae and can cause severe and chronic pain. Um, so it is a inherited progressive type of disease. It typically affects the spine, but can also spread to the sacroiliac and hip joints, including um, adjacent soft tissues in that area. Um, you would notice inflammation of the spine. Um, it can also result in fusion of the vertebrae together. Another complication could also be heart enlargement and pericarditis can occur as well. So that is the sac that contains the heart can also become enlarged, um, along with backache, stiffness, sciatic pain. Um, Lasts typically a few days and then starts to go away. Um, so etiology. The cause is unknown. Could possibly um, be related to genetics, and it might also be related to environmental aspects in your life as well. Um, could also be triggered by illness. Um, Risk factors: 90% of patients diagnosed with ankylosing spondylitis test positive for the HLA-B27 marker, um, but only around 2% of the people that have the marker, um, that have the gene, will develop um, AS. This can also go up to 20% if they have a first degree relative that has a history of the disorder. Um, so that's significant. If you have a relative that has it, there's a 20% chance. If you have the gene that you can have it as well. Um, so another thing that can be related to the disorder or disease is a frequent gastrointestinal infection, um, and younger men are at a higher risk for developing this. So the onset is between 15 and 35 years. Um, One part of a patient's life that can be affected is their daily routine can be interrupted. So in the morning, typically, they will experience stiffness that will improve somewhat with movement. Almost all cases report short flare ups where they have symptoms of pain and stiffness, and then it's followed by periods of remission. Um, some patients will experience symptoms of pain and stiffness and discomfort for long periods of time, so it can be chronic and can lead to disability over time. Two clinical manifestations of the disease are a decreased range of motion, um, and this means that the patient cannot move their body um, and function in a normal way. The patient may also complain of low backache, stiffness, and this means that the patient is experiencing pain radiating in their lower back or having difficulty with movement in general. Um, a rheumatologist is commonly the type of doctor who would diagnose AS. They're specifically trained in diagnosing and treating um, disorders that affect the joints, muscles, tendons, ligaments, connective tissue, and bones. A thorough physical exam, including x-rays, a review of medical history, family history, as well as blood work, which would include the test for the HLA-B27 marker, would be contributing factors in making a diagnosis. There's no cure currently for this condition, but it can be treated and managed with medications and exercise, along with proper diet and nutrition. In severe cases, surgery can also be an option as well, but that's like a last resort. So four main exercises that are recommended for treating ankylosing spondylitis include range of motion and stretching. So we're talking about also aerobic and cardiovascular, strength training, and also for balance. And just go into a bit more detail about range of motion. The exercises are done just with your body. We all know some simple range of motion exercises. And the point is to move the muscles and joints through their full range of motion. So this is to promote and improve flexibility, reduce stiffness, swelling, and pain, as well as minimize the risk of the fusion of bones together. As far as other treatments with medications, anti-inflammatory medications like ibuprofen are needed to maintain relief from the symptoms. And this can create problems because, especially where there is potentially a lot of gastrointestinal infections happening, it can aggravate, exacerbate that. It can also things like ibuprofen and anti-inflammatory medications can also reduce the amount of protective mucus in the stomach, which can cause more irritation. So this can lead to things like heartburn, gastritis, ulcers, and also bleeding. Other medications can be used, like Tums or other antacid medications, to neutralize or prevent the production of excess stomach acid and help to coat the stomach and restore the lost mucus. A different class of anti-inflammatories known as COX-2 inhibitors seems to reduce the risk of gastrointestinal complications from anti-inflammatory medication as well. So these are things like Celebrex that are used to help treat spondylitis. So there's some alternatives as well that are used, like nursing innovations, relaxation techniques, massage, chiropractic adjustments, acupuncture, and reflexology. So a big thing is with our scope of practice, nursing interventions, education is big. Just educating them about the disease and what it can do and what you can do to help. So they're obviously taking their medications, heat and cold therapy, and encouraging proper posture, sitting up straight, exercise, and encouraging them to do range of motion exercises so that they can remain flexible and have improved posture as well. So those are the types of things that you would be teaching about for this condition. Just kind of keeping them educated about what they need to do as far as exercise and range of motion activities that they can do to help, again, promote flexibility and prevent the bones from becoming fused as well. And as a healthcare professional, we're able to assist them with that. And, we can provide them ongoing education about exercise, their diet, and their overall health, and let them know what would be the best exercises for them individually as well. When you're working with them one-on-one, you kind of get to know your patient or resident and what they're capable of doing as well. And yeah, that's basically it. I hope you enjoy my video and have a great weekend.